Hi, I'm Dr. Neal Handel. I'm a board-certified plastic and reconstructive surgeon practicing in Sherman Oaks, California. Sherman Oaks is a suburb of Los Angeles. I was born and raised in Southern California, but after graduating from high school, I attended Columbia University in New York City, where I received my bachelor's degree with a major in art history. After that, I enrolled at Yale University School of Medicine, where I received the MD degree in 1973. I completed my general surgical training at Tulane University and Charity Hospital in New Orleans, Louisiana, and after that, I started my plastic surgery residency at the University of Colorado in Denver. Upon completion of my residency in plastic and reconstructive surgery, I went to Europe to do some fellowships in Scotland and in England. In Scotland, I spent time at the famous Cannisburn Plastic Surgery Centre, a centre of great historical importance in plastic surgery just outside of Glasgow, Scotland. I also spent time at the Great Ormond Street Hospital for Sick Children in London, as well as at the Mount Vernon Burn Unit in northwest London. After completing my fellowship training, I successfully took and passed my board examinations in plastic surgery to become a diplomate of the American Board of Plastic Surgery. I then began my private practice in plastic surgery in Los Angeles. In addition to being certified by the American Board of Plastic Surgery, I'm a member of the American Society of Plastic Surgeons, which is the world's largest organization of certified, fully qualified plastic and reconstructive surgeons. I'm also a member of the American Society of Aesthetic Plastic Surgery, which is an organization whose members' practices focus largely on aesthetic or cosmetic surgery. I've also been invited to and am a member of the American Association of Plastic Surgeons. This is an organization that represents approximately 1% of all board-certified plastic surgeons in America and is comprised of surgeons who are considered to be the academic leaders, those who've contributed both to research and publications in the field of plastic and reconstructive surgery. In conjunction with my clinical practice, I've also been very involved over the years in research related to breast implants, breast reconstruction, and cosmetic surgery of the breast. I've participated in a number of clinical trials looking at the safety of various types of breast implants. I've also performed a lot of independent research on the effect of breast implants on breast cancer detection, prognosis, and treatment. In fact, my research has led to the publication of nearly 60 articles in peer-reviewed medical journals, and I've also been invited to contribute 12 chapters to medical textbooks on breast surgery. At the present time, in addition to my clinical research, I'm actively involved in teaching plastic surgeons. I participate as an associate clinical professor at the Geffen School of Medicine at UCLA, where on a regular basis I supervise the plastic surgery residents in their treatment of plastic surgical cases. I'm also invited frequently to give lectures, not only at national meetings, but throughout the world, where I frequently address topics such as breast reconstruction, cosmetic breast surgery, the risks and side effects of breast implants, the effect of implants on breast cancer diagnosis and treatment. At the present time, my practice comprises most areas of cosmetic and reconstructive plastic surgery, including things like facelifts, rhinoplasty, eyelid surgery, the full gamut of breast surgery, body contouring, liposuction, tummy tucks, the use of facial filler materials such as Restylane, Juvederm, treatment with Botox. But a large part of my practice really focuses on breast surgery, and the reason for that is that for the first 17 years of my practice, I was the Associate Medical Director and Senior Plastic Surgeon at the Breast Center. The Breast Center was really the first fully integrated, multidisciplinary breast diagnostic and treatment facility in the United States. And I had the good fortune of working with a number of very talented colleagues in cancer surgery, in radiation therapy, in diagnostic imaging, and in medical oncology. And during my 17 years at the Breast Center, I was exposed to many challenging cases in breast surgery and really honed my skills as an aesthetic and reconstructive breast surgeon. As a result of that, a large part of my practice now really focuses on managing difficult cases, often patients who've had previous unsuccessful surgery on the breasts and who come to me for corrective reoperations. Many of these patients are women who've had previous implant surgery and may have developed problems such as capsular contracture or excessive firmness of the breasts, waviness, rippling, breast asymmetry, breast pain, poor scarring, unsatisfactory cosmetic outcomes. Most, if not all, of these problems can now be successfully addressed with the newer techniques that we employ in our practice. A lot of patients wonder how they can properly select the best plastic surgeon to meet their needs. First of all, one needs to look at the training and background of the surgeon. Did he complete his residency in plastic surgery? Is he certified by the American Board of Plastic Surgery? And perhaps most importantly, has he had a lot of experience with the procedure that you as a patient are interested in? In our practice, we've had over 30 years of experience, during which time we've successfully accomplished more than 10,000 cosmetic and reconstructive surgical procedures in patients. That extensive experience gives me the judgment and background to give you the best, most predictable results. Yeah. Another important element in selecting the plastic surgeon is to look at the kind of office staff, the people that he has surrounding and supporting him. In our practice, we have employees who've worked for many years with me and know all facets of aesthetic and reconstructive surgery. They're very familiar with the consultation process, with giving patients the proper information both before and after surgery, and providing a supportive and comforting environment for your surgical experience. The surgical facility where your operation will be carried out is fully accredited and is staffed by board-certified physician anesthesiologists, by certified and experienced operating room technicians, and registered nurses. This assures you a safe and comfortable surgical procedure. Post-surgical care can be provided either by an aftercare center that's specifically devoted to taking care of patients who've had cosmetic surgical procedures, or we can sometimes help facilitate arrangements for a nurse or medical assistant to help you with care at home or in a hotel or motel. Your relationship with me and my staff doesn't end with just a successful operation. We're committed to keeping track of our patients long term. I think it's important for me and for my patients to know that we're always available to see you months, years, even decades after surgery. All follow-up visits are free. There's never any additional charge for you to come in if you have a problem, a concern, or a question. We're always happy to see you and help you in any capacity that we can. I'd like to briefly discuss some of the economic and financial considerations that patients often inquire about. When it comes to cosmetic surgery, which is really purely elective, that's not something that's a benefit of health insurance. When it comes to cosmetic surgery, we expect patients to pay the fees in advance. That would include the surgical fees, anesthetic fees, and the charges of the operating facility. All the follow-up visits are included, so there won't be any additional charges to patients. There are, however, some procedures where insurance may play a role. In patients who've had breast cancer and undergone mastectomy, post-mastectomy breast reconstruction usually is covered, at least in part, by health insurance policies. Likewise, in many patients who require breast reduction surgery or sometimes revision of problems arising from prior implant surgery, all or part of this procedure may be covered by health insurance. Our staff is happy to help you in ascertaining beforehand whether or not your health insurance company will pay a portion of the benefits. We're also happy to help you with billing and collection from the insurance company after the procedure has been completed. Thanks very much for taking the time to watch this video. I hope that it's given you some information about plastic surgery. If you'd like to learn more about my practice or about the procedures that we regularly perform, you can visit our website, which is drhandelinfo.com. There's also some additional videos of some of my patients and their procedures on YouTube, or you can contact me directly at drhandel@aol.com. Thanks very much.